السلام عليكم. محاضرتنا لهذا الأسبوع في مادة الأدوية هي عن about the treatment of benign and malignant diseases of the prostate. Before starting with the subject, you have to be familiar with the term of LUTS اللي هو lower urinary tract symptoms. Lower urinary tract symptoms comprise a storage, voiding and post-micturition symptoms affecting the lower urinary tract. Of course, this will be caused by a disease or a pathology in the urethra or in the bladder or in the prostate. All of these organs or structures will contribute to the LUTS, the lower urinary tract symptoms. But we have to remember that in men, the most common cause of LUTS, lower urinary tract symptoms, is a benign prostate enlargement اللي هو راح يؤدي لي إلى cause obstruct the bladder outlet. Now let's return to the benign prostatic hyperplasia, which will cause prostate enlargement, a benign prostate enlargement, and as we said, this is the most common cause of lower urinary tract symptoms, LUTS, in men. Actually, this is the benign prostatic hyperplasia is a histologic diagnosis, not a clinical diagnosis. So it's a proliferation of smooth muscles and epithelial cells within the prostatic transition zone. So this will lead, the benign prostatic hyperplasia will cause LUTS, lower urinary tract symptoms, and it will contribute to the LUTS by two mechanisms, a static and a dynamic. A static, when we have an enlarged prostate, so enlarged prostate will compress the bladder outlet, while the dynamic component, there will be an increase in the smooth muscle tone in the prostate and resistance within the enlarged glands, and this will lead to also an outlet obstruction, and it will lead to LUTS. The LUTS, the lower urinary tract symptoms, comprise, it's a complex of symptoms. We have storage, voiding and post-micturition symptoms affecting the lower urinary tract. So for example, the storage symptoms, we will have like intermittent urinary stream, straining, hesitancy. يعني البيشنت يحس بنفسه انه البلادر مالته ممتلئة لكن ما يقدر يسوي تفريغ كامل. So these are the voiding symptoms. Storage symptoms, urgency, frequency, sometimes urgency, incontinence, nocturia, لأنه عندنا يعني تخزين مال urine in the bladder، فيصير عنده urgency، يعني يحس أنه يريد يروح for urination. أيضا frequent urination but not a lot of volume, and also incontinence. Post-micturition symptoms, we have post-micturition dribbling اللي هو a lot of elderly patient will have. He will have drops of urine after completing the urination. So the aim of the treatment in these patients, which are mostly they are elderly patient after 60 years of old, is to minimize the storage, voiding and post-micturition symptoms. So this is our aim. So the patient will have a more comfortable life. And also, one of the most important complication of benign prostatic hyperplasia is acute retention. So we need a drug that will decrease the incidence of acute urinary retention in these patients. So a combination of these two aims to relieve the symptoms and also to prevent the acute urinary retention is our main goals of the treatment of these patients. We will see that not all the drugs that are used in the treatment can achieve both of these goals. This is what we said about the voiding symptoms, the storage and post-micturition symptoms. Pharmacological management, we will use the drugs. So the first class of drugs to be used is the alpha-1 adrenoceptor antagonist, alpha-1 blockers. You have been familiar with the alpha-1 blockers when it is used as an antihypertensive agent, because the alpha-1 receptors, they are present in the cardiovascular symptoms, they are present in the arterioles and also in the veins, and we have we have another subset of alpha-1 receptors present in the bladder outlet. Of course, we have subtypes of the alpha-1 receptors. The alpha-1b receptors present in the cardiovascular system. Alpha-1a, it is confined to the prostate or the bladder outlet. ولذلك إذا استعملنا drug that can block both the cardiovascular alpha-1 and the prostate alpha-1 راح يصير عندنا شنو؟ راح يصير عندنا cardiovascular side effects اللي احنا ما نريدها. and شنو السايد effects اللي راح تصير عندنا؟ راح يصير عندنا orthostatic hypotension in those patients، لأنه طبعا إذا يصير block to the alpha-1 receptors in the veins راح يصير عندنا orthostatic hypotension، and we will have also hypotension due to the blockage of alpha-1 in the arterioles. هاي احنا ما نريدها in these patients، خاصة بالelderly patient اللي يصير عندهم شلون يجي orthostatic hypotension، وهايبوتنشن يصير عنده dizziness، وممكن انه يصير عنده الهايبوتنشن ممكن يسبب عنده fall، يعني transient unconsciousness or collapse اللي هو خطر بالelderly patient، لأن ممكن يسبب عندهم fractures، and also it is very bothersome، it's very bothering for these patients. إذن the preferred agent هو agent that will block the alpha-1a. This is the preferred agent. So, regarding the alpha-1 adrenoceptor antagonist, alpha-1 blockers, these agents, as you can see here, they can be used in the treatment of benign prostatic hyperplasia. We have alphozocine, doxazocine, silodosin, and tamsulosin. Those which are selective for the alpha-1a اللي هي موجودة بالprostate هو silodosin and tamsulosin. The others are not very selective for those receptors. So what is the effect of the alpha-1 blockers in these patients? They can reduce both the storage and voiding LUTS symptoms. But when it is used طبعا the size of the prostate is a very important parameter in the treatment. لذلك إذا the prostate volume less than 40 ml, the alpha 1 blockers are a perfect choice. Maybe we don't need any other drug لأنه ممكن نحتاج combination of drug. لكن لازم نتذكر أنه الألفا blockers they do not decrease the prostate size. عندنا other drug راح نشوف other class of drugs will decrease the prostate size, and most importantly they will not prevent the acute urinary retention in long-term studies. لكن what is the benefit of these drugs? They will act quickly, they can relieve the symptoms in patients نحتاج إلى دواء سريع الفعالية بحيث patient he will get relief of the symptoms of اللي هي storage and avoiding lots، يتخلص من هذا sense of incomplete emptying، من urgency، كلها راح يحقق لنا اياها الالفا 1 adenoceptors. لكن نتذكر انه ما راح يقلل البروستيت سايز will not prevent the acute urinary retention، لذلك هو مناسب for patient اللي هم عندهم بروستيت اقل من 40 مل الحجم مالته، and for rapid relief of the LUTs storage and voiding symptoms. most two selective alpha blockers اللي هي للالفا 1A اللي قلنا الالفا 1A موجودة bladder outlet in the prostate. We have the tamsulosin and silodosin. Silodosin, they have affinity for alpha 1A receptor almost 600 times than the alpha 1B, so it is very selective agent. Tamsulosin is also selective, but it's like 6 times folds higher affinity for alpha 1A than alpha 1B. Tamsulosin is commonly used. Silodosin is a new agent. It's expensive, but it is very selective. But tamsulosin will do the purpose of it. The most important side effects هو مثل ما قلنا هو المشكلة بالألفا 1 when you have an agent that can act on the alpha 1 receptors present in the arterioles and the veins راح يسبب لي orthostatic hypotension, asthenia and dizziness. هذا الإفكت طبعا it's not seen in the more selective alpha 1 blockers اللي هي silodosin and tamsulosin. They are more selective. طبعا the best is the silodosin regarding the selectivity. The last thing we have to consider is the side effects of these drugs. طبعا we have side effects بصورة عامة. The non-selective one اللي هي will cause orthostatic hypotension, dizziness in these patients due to the cardiovascular effect of these agents. But regarding the selective ones, we have a peculiar and characteristic side effect with tamsulosin. البيشنت اللي عنده cataract surgery وياخذ tamsulosin, he is at risk of this syndrome اللي هو intraoperative floppy iris syndrome اللي هو characterized by iris billowing meiosis and prolapse. لذلك البيشنت اللي عندهم cataract they should discontinue these drugs اللي عندهم surgery. Other side effects regarding the abnormal ejaculation, and it has been observed more with tamsulosin and silodosin than the other alpha 1 blockers. So, in the clinical pharmacology, when to use the alpha 1 blockers? Alpha 1 blocker is an important first line drug treatment of patient male with lower urinary tract symptoms because of the rapid onset of action, good efficacy, and lower rate and severity of adverse effects. So it would be used for all patients with benign prostatic hyperplasia having LUTS. طبعا regarding the efficacy, the alpha 1 blockers have the same efficacy. المشكلة وين؟ المشكلة فقط يختلفون بالside effects. If you have more selectivity to the alpha 1A, you will have less cardiovascular side effects اللي هي dizziness and hypotension. Otherwise they have the same efficacy. تعتمد على tolerance of the patient. Okay. The other class of drugs, which is very important also and can be used in the treatment of benign prostatic hyperplasia, is 5-alpha reductase inhibitors. We have the finasteride and dutasteride. These are the most commonly used agents. طبعا خلينا نتذكر، لازم نتذكر في شيء. We have to know about something, that the prostate cells are dependent on the testosterone for their growth and maintaining their viability. The testosterone, this is testosterone, this is a steroid hormone binding globulin. طبعا هذا attached, this is outside the cells. Testosterone will enter the cell. We are talking about the prostate cells, prostatic cells, and inside the cell it will be converted into an active form لأنه testosterone نفسه ما راح يكون active. It has to be converted or metabolized into an active form, which is dihydrotestosterone, by the effect of 5-alpha reductase enzyme. فإذا ما عندي dihydrotestosterone inside the prostatic cells كأنه احنا ما عندنا effect of testosterone on the cells. And so this is the mechanism of action. If I inhibit the 5-alpha reductase, there will be no dihydrotestosterone inside the prostatic cells, and this will lead to apoptosis of these cells, which means يعني راح يصير عندي cells أقل، معناها راح يصير عندي the prostate size will be less. راح يصغر البروستيت سايز تقريبا ب25%، اللي هو هذا يختلف عن الافكت of the alpha 1 blockers. كأن الالفا 1 blockers will not affect the size of the prostate. هنا لا، هنا الميكانيزم of action تختلف. The 5-alpha reductase inhibitors will reduce the size of the prostate by like 25%. So there will be prostate size reduction of about 25%. Also it will لما راح يقل عندي السايز، طبعا المفروض تعرفون شنو ال PSA prostate specific antigen ايضا راح يقل، لانه هذا this will reflect the mass of the prostate. فراح يقل السايز of the prostate by 25%. PSA levels will decrease by 50%. لكن هنا راح تشوفون الإفكت. احنا نحتاج هنا وقت أطول for the 5-alpha reductase inhibitors to act. We are talking about months. ولذلك إذا نريد إذا عندنا patient عنده symptoms، ما معقول أنا أعطيه هذا الدراج وأنتظر أشهر حتى يشتغل. لازم أبدي بمن؟ أبدي بالألفا 1 blockers. and we can combine the alpha 1 blockers with the 5 alpha reductase inhibitors. So these drugs are most effective for patients with larger prostate. لذلك. So another effect of the 5 alpha reductase, which is very important, it will reduce the long-term risk of acute renal retention or the need for surgery. هذا أيضا يختلف عن الألفا 1 blockers اللي قلنا ما تقدر تقلل الريسك of acute renal retention. طبعا a larger prostate معناها شنو؟ معناها ممكن واحد من التريتمنتس or the lines of management of the benign prostatic hyperplasia إذا عندنا large gland نحتاج surgery. إذا صغرنا حجم البروستيت the need for surgery will be less أو يجوز ما نحتاجها. So these are the most important differences between the alpha 1 blockers and 5 alpha reductase inhibitors. هسه نجي ايش وقت راح نستخدم ال 5 alpha reductase. قلنا بالنسبة للألفا 1 blockers نستخدمها إذا عندنا patient عنده lower urinary tract symptoms prostate أقل من 40 ml that will be perfect for them. لكن هنا عندنا patient who has a prostate size more than 40 ml نضيف لها أو عندنا PSA أكثر من 1.4 نانوغرام بير مل. هنا راح نعطي إضافة إلى الألفا 1 بلوكرز راح نعطيهم 5 ألفا ريدكتيز انهبيتور. ليش؟ لأنه قلنا احنا هذا الدراج 5 ألفا ريدكتيز انهبيتورز يحتاج أشهر حتى يبدي يشتغل. ايش راح يفيدنا الالفا 1 بلوكر؟ راح تشتغل بسرعه، راح تخفف السيمبتومز اوف ذا بيشنت الى ان راح يشتغل. عندنا ال5 الفا ريدكتيز انهبيتورز راح تقلل الحجم مالت البروستيت، تقلل الريسك مالت الاكيوت retention and sometimes maybe we can discontinue the alpha 1 receptor blockers. لكن هذا أيضا عليه it is different opinions by different guidelines. But this is هاي يعني الصورة المتفق عليها إنه combination is a good one for large prostates. لازم نتذكر أنه ال 5 alpha reductase inhibitor it will decrease the serum prostate specific antigen concentration. Prostate specific antigen is one of the tumor markers اللي نستخدمها for the diagnosis of prostate cancer. لذلك البيشنت اللي ياخذ 5 alpha reductase inhibitor the normal level of the PSA is not as the patient who does not take the 5 alpha reductase. فإذا أسوي screening for prostate cancer I should put this in consideration that the normal levels will not be the same. يعني راح يقلله، فمعناها الnormal levels لازم هنا another normal values for these patients for screening for a prostate cancer. What are the side effects of the 5 alpha reductase inhibitors? Most of them they are related to sexual dysfunction. It can reduce the libido, the sexual drive and desire, erectile dysfunction, ejaculation disorders and gynecomastia due to the effect on testosterone. Other drugs that also can be used with for some conditions that are less important than the two classes اللي هنا أهم two classes in the treatment of benign prostatic hyperplasia هو الالفا 1 blockers and 5 alpha reductase inhibitors. Other drugs عندنا الphosphodiesterase 5 inhibitors tadalafil, and also we have emerging therapies اللي هي beta 3 agonist mirabegron. They are less important than the other two class.